my name is Kyle. I'm a student of physical therapy. How are you doing today?
I'm good. How are you?
I'm good. Is there a name you'd like to go by?
Shoaib is fine.
Okay. So you're coming in for your knee, right?
Yeah.
Which knee is it?
It's the right knee.
Right knee? Okay. And do you have any other body conditions, any injuries, any surgeries in the past? Anything like that that I should be aware of?
No, I'm pretty healthy.
Okay. Taking any medications?
Yeah, I am taking ibuprofen for the pain.
Okay, just for the knee?
Yeah, just
Okay.
for the knee.
Okay, sounds good. So then, with that being said, just take a minute and let me know what happened to your knee, what's bringing you in today.
Okay, so about a week ago, I was playing soccer. Just testing out these new cleats that I got. I was playing on turf, and it's not really a good quality field, but I was doing some cutting drills, and when I was going through like this ladder drill, right and left, going through it, I kind of like pivoted off my right knee, and then started getting this pain after. I don't know, I can't remember if it swelled up or not. I always like in my workouts in an ice bath. Because it was hurting, I stopped early in the workout, hopped in an ice bath, and then they were like, oh, if it's still bothering you, maybe you should go get checked out. So
Okay.
here.
So how long ago was that?
So that was a week ago.
A week ago.
Yeah.
Okay. And when that happened, do you remember like hearing or feeling a pop, or did it give out, or did it buckle, anything like that?
It buckled a little bit, and I know sometimes, because that was like a week ago, sometimes if I'm walking or something, especially if I'm like going upstairs or something like that, if I'm turning around in the kitchen, I'll feel it, kind of feel like it wants to give out a little bit.
Okay. And since it's happened, have you felt any like cracking or like grinding or anything like that?
No grinding. It definitely feels a little bit like there's something in there.
It like catches, like it's like stops you from moving or something?
Yeah.
Okay. Okay. And have you ever hurt that knee before?
No, this is my good knee. This is my side that this is my kicking leg.
Okay. So no pain on the knee before a week ago, and nothing has since happened since that one thing when you were playing soccer?
No, my coach has been just kind of making me be like the towel boy, and I've been just kind of like resting it, but it's not getting any better. So
I'm sure you're loving that.
yeah, it's terrible.
So when you planted, you said you were turning. So you planted your right leg, and then were you turning to the left?
Exactly. Yeah.
Okay.
And my
Gotcha.
right, and I turned to the left to get the ball, and just did not feel good.
Okay. And if you could point with one finger where you're feeling the most pain, can you show me where you're feeling that?
Yeah, it's like in here, but it's like deep inside.
Okay.
It's not like.
Okay. So is this something you can feel, or not really? It's
No, I feel it. Like I feel the pain. It just
Okay.
feels deeper inside. It's not like something I can touch without like going inside my knee.
okay. Yeah, that makes sense. What kind of pain is it when you feel pain? Is it dull? Is it sharp? Is it tingling or throbbing?
It's usually sharp.
Sharp.
Yeah.
Okay. And is there anything that you can do right now that would make it hurt, or that over the past week that you've noticed makes it hurt?
Usually the thing that hurts it the most is whenever I'm like kind of sidestepping. Anything like that will usually hurt it. If I sidestep this way, or coach is letting me kind of lead the drills, the soccer practice. So whenever I do like the demo, like, oh, we're gonna do karaoke, and I like twist my legs or something like
Gotcha.
that, just to show them
Yeah.
what we're about to do. That'll hurt it.
Okay. So if you had to rate your pain that you're in right now from 0 to 10, 0 being no pain and 10 being you're in the emergency room, what would you rate your pain right now?
Right now, I would say maybe a 2 or a 3.
Okay.
It's not too bad.
And does it ever get better than that?
Maybe when I'm sleeping, I don't notice it as much.
Okay. Does it get down to a 0? Like, is it bugging you at night? Do you wake up at all because of the pain? Or you really don't feel it at all?
No, I'm a pretty deep sleeper.
Okay.
I usually just knock out.
Okay. Nothing during the day that makes it get down to a 0?
No, maybe when I'm icing it,
Okay. Gotcha.
it'll get like numb, and then I'd be okay for 30 minutes or so, and then it'll
Okay.
start coming back.
And besides like walking, changing directions, that kind of thing, how would you rate your pain when it's at its worst? And is there anything that you're doing?
Yeah, it's usually at a 7, and that's when I'm like, whenever I'm like kind of like twisting on my knee, like doing those like demos for like the warm ups for the team, or if I'm in the kitchen and I'm like standing up to get into like that like, cabinet over here, and I'll like squat and twist, and then that'll be painful.
Gotcha. Okay, so you said you got new cleats.
Mm-hmm.
So was that like your first time using new cleats, or
Yeah, those
Okay.
I was trying to break them in.
Okay, and have you noticed, do you now have pain with squatting or sitting up from a chair or sitting into a chair?
Yeah, that'll hurt it when I start to really like flex my knee while I have like weight on it, like from squatting or something
Okay.
like that. That'll
Okay.
bother it.
And do you have any pain just standing?
A little bit, but you know, not bad. It's kind of like my normal, like just like a 2 or a 3
Okay, gotcha.
all the time, just achy.
Okay, so I know your team, you said that they told you if it's not feeling very good, maybe you should come see me.
Yeah.
Did you go see a doctor or anyone else? I don't know if you have an athletic trainer or anyone like that. Have you seen anyone before seeing me?
The AT took a look at it. He said my my ACL and my PCL was good.
Okay.
And I didn't have any of the side ligaments. He said that's all good. So he said just rest and we'll see.
Okay, gotcha. And I know you said you've been icing it, taking ibuprofen. Is there anything else that you've been doing to help the pain?
No, just icing it, taking ibuprofen. I guess when I'm relaxing, watching TV, I'm trying to keep it up, like on some pillows or something, just to help with the swelling.
Okay. And are you a student right now?
Yeah.
Yeah. Okay.
Yeah.
So do you feel it affecting your schoolwork or studying, anything like that?
I guess a little bit. I mean, with the studying, just like the aching pain kind of bothers
Just
me.
kind of nagging
Yeah.
a little bit. Okay. So do you do anything else recreationally besides soccer?
In the off season, I play basketball.
Okay.
Yeah.
Gotcha. Okay. So what are your goals for working with me? Like, what do you want to get back to?
I want to get back to playing with the team. I want the pain to stop because it's really just kind of really annoying me at this point. Because it's just got pain with like everything I told you,
Yeah.
pivoting
Yeah.
and stuff like that. And that way I can get back to soccer, maybe finish the season, and then at least be ready for basketball in the off season.
Okay. And is there something else you'd like to let me know or tell me about before we move on?
No.
All right. Sounds good.
All right.
Okay, so as I said, I suspect you do have a lateral meniscus tear of your right knee. There are options for surgery and no surgery. It's not really something I can determine at this time, but you said you haven't seen a physician before, but I would like you to see an orthopedic physician. You have a team physician that works with you with your school, right? With the soccer team?
He was on leave.
Okay, gotcha. So I'll get in touch with your athletic trainer and have them set up an appointment with your orthopedic physician, okay? And they'll discuss the possibility of maybe needing crutches or a brace, and they may take some radiographs and an MRI to see the severity of your tear, and then there are options for surgery or no surgery. But nonetheless, there are some things we can work on right now that can get your strength and range of motion back. And I also want to start working on your hips. If you noticed, your leg kind of caves in when you do some squatting. I just want to start working on some light stuff to start correcting that, okay?
Okay.
So the first thing we're going to do is called a quad set. I just want to get your quad strength back. I noticed that it's pretty weak, and usually after a knee injury that strength does tend to go away. So that's something we want to get back immediately, okay? So I'm going to put this under your knee, just like that. And what you're going to do is you're just going to basically push your knee down into the towel, trying to lift your heel up like that. Just trying to straighten your knee completely, okay? So you're going to squeeze your quad, this muscle right here, kind of push your knee down and lift your heel up. Good. And what I want you to do is hold that for about 5 seconds and then relax. And we're going to do that 10 times, okay?
Okay.
So I know it's hard, I see your muscle working though, so as long as you see that kind of twitch and contraction in your thigh, you know you're doing it right, okay? And you should feel that heel coming up off the table a little bit. Good, so when you do this at home, I want you to do 3 sets of 10, 1 time per day, okay? And you can take about a minute rest between sets, okay?
Okay.
So the next thing that I'm going to have you do is called a heel slide. I noticed that your bending of your knee or your knee flexion is also limited. Okay, so that's something we want to work on.
Okay.
So what we're going to do is we're going to put this around your heel here, and you're going to reach forward, hold this with your hand, and I want you to try to use your back thigh muscles, your hamstrings a little bit to try to squeeze. You're going to slide your heel up the table towards your stomach and your butt. And whatever you can't do with your leg, you're doing with your hands, just like you're doing. Good. And when you get to that end range where you feel like you can't go anymore, hold that for about 5 seconds, and then you can lower it back down, okay?
Okay.
I know that's a little uncomfortable, but it's really important to get that motion back as soon as possible, okay?
Sounds good.
So for this one, I want to do about 20 times, and I'd like to do that multiple times per day, almost like we're stretching this muscle, okay? So if you could do it 2 to 3 times per day, or honestly just any time that you're relaxing at home, that will be helpful, okay?
Okay.
Good. You feel pretty good with that?
Yeah, I think I got that one.
All right. So last thing we're going to do is the hip exercise, okay? So if you could slide this up just above your knees on both sides. These are called clamshells, okay? You may have done them before with your sport.
Yeah,
But
sounds familiar.
yeah. So you're going to lay on your left side, so you're going to face me. Yep, and you're going to get those knees right on top of one another, bend them just a little more. Good. And then keeping those heels together, you're just kind of going to bring this knee up, okay? So think about your knees being a clam. You're going to come all the way up and come down, okay? The one thing I don't want you to do is rotate your upper body out, okay?
Okay.
Good. Looking good. I know that's hard, but the more we do that, the better, okay?
Okay.
So I'd like you to do that 3 sets of 12, 1 time per day. And we're going to do it on both sides, okay?
Sounds good.
So you're going to start laying on your left side, and then you'll do it on the right side, okay?
Okay.
Any questions for me?
No.
All right, great job. We can finish up with some ice, and then I'll get you that referral to your doctor, okay?
Okay.
All right, have a good day.
Thank you.